Hey YouTube, it's me again. I just wanted to discuss my pre-admission testing, and I met the anesthesiologist and she went through all the different things that might occur not during the surgery, but before the surgery, and the risks and all that kind of stuff. So I went to pre-admission testing on April 23rd. So I believe that was Tuesday, and I got my bloods drawn, I got EKG, everything looks pretty good. I had a physical right after, so she got to see some of the bloods that already came in, and everything looked good. So I'm not expecting any flags to be thrown up or anything. The surgery should be on schedule for May 7th. And then I got to meet the resident anesthesiologist. I'm not sure if she's actually going to be the one that day, but she just gave me the rundown of what anesthesiologist does and the different types of things I might go through before surgery begins. So she went through all the risks, and of course I feel that any surgery, you either die from complications or you die from anesthesia. The anesthesiologist really has a lot to do with how much they pump into you and what is appropriate for your body weight and your height and all that kind of stuff. So I suffer from sleep apnea, so I have a BiPAP machine that I use every night, and I also have asthma that I've had since I was 2 years old. It's not chronic. I'm never had an asthma attack. It's just wheezing. So they have me on preventative pump, albuterol, and they're making sure I use my BiPAP machine every night to strengthen my lungs for the intubation. She told me a little bit about the intubation. She said that they might have to intubate me awake. Intubation awake doesn't really freak me out. I mean, I don't easily get squeamish or I don't easily gag, so it doesn't really freak me out as much as some of my friends or even my mom. I've told them that I have to do it awake. I might have to do it awake, and they're freaking out a little bit, but I'm fine. She went on to say that they'll numb my inner mouth, my tongue, and then the swab will go further back and numb, so that I won't be gagging when the tube is all the way in. And once I'm intubated, they're gonna give me the anesthesia to make me pass out, basically go into dreamland. So I'll be intubated for seconds before I even realize it. I'll be waking up by the time I realize that, oh, okay, I was awake during my intubation. Other things she told me, just questions about reactions that maybe my parents have towards anesthesia, so they can write a note in my chart to make sure that if any of these reactions occur, they could go a different route. My dad's had surgery before, and he goes into surgery and has anesthesia like a champ, no issues. My mom, on the other hand, has a really bad reaction towards it. She has had 2 different surgeries, and in one of them she actually woke up and pulled her intubation tube out, so they had to re-intubate her and give her more anesthesia, which put her into shock. So there's a lot of things that could go wrong because of my genetic makeup, because of my parents, but I'm hoping that I lean towards my father in that aspect so that nothing goes wrong with the anesthesia. The second thing that was pretty, I guess it wasn't hard to hear, but it worried me. The surgeon had told me this before, that there's always a chance that they'll have to open me and not use the laproscopic technique for the surgery. So they'll open you from your breastbone down to your belly button, which I really hope doesn't happen. I mean, the recovery rate for that is a lot longer than just having 5 incisions. So she said, the anesthesiologist said, because where I carry my weight is mostly in my stomach, in my boobs, so is my abdomen area, that when I'm laying down, it'll be pushed up towards my chest, and then they inflate your stomach with air so that there's more space for the rods to do the surgery. So that's even more pressure on my diaphragm and my lungs. So that's why I'm doing all these preventative things to strengthen my lungs, so that they could do it laproscopically and I don't have to be cut open from breastbone to belly button. That's the only big thing that's worrying me. I mean, hopefully it doesn't happen. I'm praying on it. So yeah, that's everything that I found out from the anesthesiologist and my pre-admission testing. So talk to you guys later. Bye.